Anne?
Yeah, at the staff level, we were just going to check in with one member. Do you mind giving us just another minute, Ricardo? Thank
Sure.
you.
Thank you for letting me know. Thanks.
Hi, Ricardo. You do have a quorum of members present should you want to start now. Nicole is joining now, so it'll be just another moment for her, I think, to do a test.
Yeah, let's go ahead and wait for Nicole and give her a couple of minutes here.
And this is the moderator. Looks like Nicole has joined us. Nicole, would you like to do a quick mic and camera check?
Hi, yes, I'm here just trying to get my video started.
Excellent. We can hear you fine. Thank you.
There we go.
Hi, Nicole. Okay, we have a quorum, so I'll go ahead and start now. Welcome to the July 19th, 2022 meeting of the Communication and Public Education Committee. I'm Ricardo Sanchez, the committee chairperson. This meeting is being conducted as a teleconference meeting via WebEx. People watching the webcast can only observe the meeting. Anyone interested in participating must join the WebEx meeting. Instructions are posted on our website. All lines are currently on mute with the exception of our council. Lines will remain on mute until I direct staff to open them for public comments. I will announce when we are accepting public comments. I have advised staff to allow 3 minutes to each person providing comments. This approach is necessary to facilitate this meeting and ensure the committee can complete its business. I appreciate your understanding and patience. I will now ask the moderator to provide instructions to the public. Moderator?
Thank you, Mr. Chair. Before we get started, I would like to remind committee members and senior staff who are not speaking to mute their microphone. If I detect background noise during the meeting as a result of unmuted microphones, I will interject with a brief friendly reminder or simply mute the microphone. To facilitate public comment, we will be utilizing the WebEx question and answer feature. When the committee chair reaches a point in the agenda at which public comment is appropriate, public comment will be requested. At the committee's direction, I will turn on and announce the opening of the Q&A feature. It is not necessary to identify yourself in order to make a public comment. Please note that the Q&A feature is being used only as a means for members of the public to represent that they would like to make a verbal comment. Once given permission to unmute, the member of the public may unmute themselves and verbally state their comment. The Q&A feature is not to be used for typing out questions or for committee members to communicate with one another. If any attendee uses a profane name, they will not be called upon to prevent members of the public from being subjected to profane language. While you are free to express criticism or negative views, for the sake of the members of the public participating on the call, please do not use profane language when making public comments to the committee. And now I return the floor back to you, Mr. Chair.
Thank you. We will now move to agenda item A, which will be call to order and establish of quorum. I call this meeting to order and will take roll to establish a quorum. Members, as I call your name, please remember to unmute your line for speaking. Jose de la Paz.
Present.
Kula Coing. Okay. Is Kula not on, Anne?
Kula has not joined the event.
Okay. Nicole Thibault.
Present.
Thank you. Jason Weiss.
I'm here.
Excellent. Okay. And how, well, we can proceed now. Thank you. We have a quorum. Let's move on to item B. Public comment on items not on the agenda, matters for future meetings. The committee will now hear public comments on matters that are not on the agenda. The committee cannot discuss or take action on any matter raised here except to place it on a future agenda. Are there any public comments regarding items not on this agenda? Moderator, will you open the lines for public comment?
Thank you, Mr. Chair. I've opened up the Q&A panel. If any member of the public would like to make a comment, please type comment in the field in the lower right-hand corner of your screen and submit it to all panelists, or you may simply raise your hand. If you've called into the meeting, you could raise your hand by pressing *3. We are displaying instructions and we'll give you a moment. All right, I see no request for comment at this time. Mr. Chair, shall I close the Q&A panel?
Yes, please.
Okay.
Thank you. Do any committee members have any comments? Okay, thank
Not
you.
at this time.
Oh, I'm sorry. Who was that?
No, this is Jose. I just said none at this time for me.
Okay, fine. Thank you. Let's move on to item C. Approval of the April 26, 2022 Communication and Public Education Committee meeting minutes. A draft of the minutes is in attachment 1. Members, are there any comments that would anyone like to make a motion and second on the minutes?
I would make a motion to approve.
Okay,
This is Jason. I'll second.
thank you. Before we vote, is there any public comment on the minutes? Moderator, please open the lines.
Thank you, Mr. Chair. I've opened up the Q&A panel. We are displaying instructions, so we'll give the public a moment. All right, I see no request for comment at this time. Should I close the Q&A panel?
Yes, please.
Okay.
Okay, thank you. I will now call for members to vote. Jose de la Paz,
Yes.
okay. Kula Coing, I'm not sure if she joined us already. Guess not. So Nicole Tebow,
Yes.
thank you. Jason Weiss,
Yes.
thank you. And I vote yes. Thank you, members. We will, and the motion passes. We will now move on to item D. Discussion and consideration of providing education to licensees about the Institute for Safe Medication Practices. Acronym is ISMP. A little background on that. At the January 2022 meeting at the Medication Error Reduction and Workforce Committee, members heard a presentation about the Institution of Safe Medication Practices, ISMP. The committee learned about many resources ISMP provides to help healthcare workers prevent medication errors. ISMP publishes tips for preventing medication errors and alerts regarding issues that require immediate attention. ISMP also publishes lists of confusing drug names to help healthcare workers and consumers understand their prescription medications. The Medication Error Committee members suggested the Communication and Public Education Committee consider opportunities to educate licensees about ISMP and its tools for preventing medication errors. At today's meeting, staff is recommending publishing an article in the script describing ISMP and highlighting its resources to help licensees prevent medication errors. In addition, a link to ISMP could be posted under important information for licensees on the board's website. Staff welcomes committee members' comments on the recommendation or any other suggestions. Are there any committee member comments?
This is Jose. I would be supportive of that.
Okay.
Hi, this is Nicole.
Yeah, go ahead, Nicole.
Yeah, I was gonna say I'm on both of these committees. And as a licensee member, I use the ISMP tools routinely, I would highly recommend that we do this.
Excellent. Any other comments? Okay, hearing none. Thank you, members. Are there any public comments?
Thank you, Mr.
Ricardo, while we're
Yeah, go
I
ahead.
apologize for the interruption. Yeah, just really fast, wanted to let you know that member Kula has joined, and perhaps we could do a quick sound check.
Okay.
Thank you.
Mic check, 1, 2, 1, 2.
We can hear you.
Oh, that came in loud and clear.
Thank you.
Welcome. Okay, let's go to public comments.
Thank you, Mr. Chair. I've opened up the Q&A panel. If any member of the public would like to comment, please type comment using the field in the lower right-hand corner of your screen and submit it to all panelists, or you may simply raise your hand. If you've called in, you can raise your hand by pressing *3, and we are displaying instructions, and we'll give you a moment. All right, I see no requests for comment at this time. Shall I close the Q&A panel?
Yes, please.
Okay.
Okay, thank you. And is there, do we need a motion on this, or can we direct staff to publish the article in the script?
Yeah, I think if members agree with the proposed actions, we can just take that as staff direction.
Okay. Is there any board member that opposes it or has any questions on it? No? Okay. Well, then we'll go ahead and just direct staff to publish the article in the script. Let's move on to discussion, item number E, discussion and consideration of providing naloxone educational materials for pharmacists. A little background. At the July 2021 Enforcement Committee meeting, members discussed challenges in getting pharmacists to furnish naloxone. Some said pharmacists are too busy to furnish naloxone. Others said the naloxone protocol requires pharmacists to engage with patients, but many pharmacists are uncomfortable or do not want to engage with patients. The Enforcement Committee recommended the Communication and Public Education Committee develop educational materials to assist pharmacists in understanding the value of naloxone and how to operationalize naloxone distribution. Today's meeting, staff notes the board's website includes a training webinar for pharmacists to meet the requirements of the state's protocol for pharmacists furnishing naloxone. The website also has other tools for pharmacists, including facts and questions, sample naloxone labels, fact sheets, and screening questions in English and 6 other languages. Staff is recommending publishing an article in the script about the board's online resources to assist pharmacists furnishing naloxone. The article also would discuss the importance of furnishing naloxone and the role pharmacists play in providing naloxone in communities. Staff welcomes committee members' comments on the recommendations or any other suggestion. Are there any committee member comments?
Hi, this is Nicole again.
Hi,
Just just wanted to say yes, I think this would be very helpful. I think would be particularly helpful to pharmacists if there could be some examples of how to operationalize this in a pharmacy, because I think that's where a lot of people get stuck, is how to actually go ahead and do the process. So if it would be possible to have some examples for an outpatient retail type pharmacy, I think that would be helpful.
And is that something we can add to this?
Yeah, we certainly can. We're going to need to probably engage with some people that are already doing it and then learn from them to then memorialize. But yes, we're happy to find partners to assist.
Excellent. Is there any other member comments?
Hi, Ricardo. This is Jason. I
Hi, Jason.
really support the measure. I think this is a vital issue that's facing the whole country right now, and I think it's important that pharmacies and pharmacists participate in trying to resolve this. So I wholly support it. Thank you.
Yes, I agree with you. It's life-saving and it's, it's there. I had the training on it and definitely it's something that's needed. Any other comments from any of the other board members? Okay, well, um, thank you, members. Are there any public comments? Moderator, can you open it up for the public?
Thank you, Mr. Chair. I've opened up the Q&A panel. If any member of the public would like to comment, please type comment using the field in the lower right-hand corner of the screen and submit it to all panelists, or you may raise your hand. We're displaying instructions and we'll give you a moment. All right, I'm seeing no request for comment at this time. Shall I close the Q&A panel?
Yes, please.
Okay.
Okay, thank you. Let's move on to item F. That's discussion and consideration of the committee's strategic plan objectives. Anne, since you have a good handle on this, would you like to cover this?
Sure, happy to do so. So, as you may recall, in September of last year, the board completed its strategic planning session. There were a number of activities that were undertaken as a precursor to that. So, from a process standpoint, on an annual basis, each committee reviews their respective strategic objectives to, one, confirm that they're still appropriate, but then also to measure where we are in terms of fulfilling each of those strategic objectives. So what staff have provided in the chair report is a list of each of the strategic objectives, and where there's a status, then staff have indicated the actions that have been taken in the past fiscal year to help fulfill those strategic objectives. So as a committee today, it would probably be appropriate to confirm that the objectives are still appropriate, see if there are additional objectives that may be appropriate to recommend to the full board to consider integrating into its plan moving forward. So from a process standpoint, after the committee makes its discussion and if any changes, recommendations to the full board, those will then be considered at the full board meeting next week. So I hope that was helpful.
Yes. So if there's any additional suggestions from the board members or the committee here, go ahead and let us know. I know you have you've gotten all the recommendations there. They're 4.1 through 4.8. Any questions on that, on the strategic plan objectives?
This is Jose. I think the objectives are still in line with the
Yes.
original objectives that we had set. So I don't think there's any changes from my perspective that need to be made. I think we'll revisit those as we come up with new objectives later in the year.
Yeah. Any other member have anything they would like to add?
Yes, this is Nicole. Wanted to jump in. One of our strategic goals, 4.7, is to improve communication to licensees by personalizing it and decreasing verbiage to encourage licensee engagement. I just wanted to add to that. We may want to consolidate. There are certain days where, particularly if there's a lot of drug recalls or things where you'll get 3, 4, 5 emails from the board. And I think if there was a way we could consolidate and send one daily update with the multiple items, we might get more engagement from licensees. I know sometimes I even have a hard time reading them all when they come through as multiples.
Okay. Anne, do you see any pros or cons to that, or is that something we can work with?
Yeah, I think, oh, sorry, the lights just went out in the room I was in. Whew. Okay, so no, I think that, Nicole, thank you so much for that feedback. If the committee's okay, we're going to take that note back and talk internally to see the best way to implement that. I think sometimes at the staff level, we don't know how many are going to be coming in, but if members are, feel comfortable with us maybe delaying the release of something for a few hours, so we're sending them out at the end of the day. That seems like something we could very easily operationalize. I'll confirm with staff and we'll report back.
Okay. Excellent. Excuse me. Okay. Any other comments? Okay, hearing none. Thank you, members. Any public comments?
Thank you,
Moderator, can you open it up for them?
Thank you, Mr. Chair. I've opened up the Q&A panel, and as always, members of the public may also just raise their hand. We are displaying instructions, and we'll give you a moment. All right, I am not seeing any requests for comment or any raised hands. Would you like me to close the Q&A panel?
Yes, please.
Okay.
What did, just before I saw something jump into chat from Maria Serpa. It said comment. Was that not a comment, or was that something that just, I'm not sure why that popped up.
I
I
didn't even
was
see Maria Serp on there.
She's an attendee, and I was request for comment go through the Q&A panel, not chat. So, Maria, I'll go ahead and unmute you. And if you have a comment, please feel free to unmute yourself. You should be able to.
Hi, it's Maria Sorpa, public member today at your committee meeting. Thank you for being patient with me since I don't often add to public comment. The only thing I wanted to add, just for everyone's consideration, is I really agree with Nicole's comment about timely and quantity of emails and information that comes out from the board, but I am concerned about delay. One of the things that we do get comments from individuals is, information about recalled items. They always come out on a Friday at 5 o'clock. So I think that kind of a delay is really not really good for something that is a recalled medication that we need to have more timely information on. So I'm sure the staff could coordinate their communication such that patient safety issues would still go out on a more urgent basis. That's all. Thank you.
Maria, I just have a quick question, if you don't mind. Is there a particular date you would suggest to have that the notification going out?
So for patient safety issues, they should go out immediately because we need to pull the medications if there's a patient safety issue.
So it's not necessarily the day, it just as soon as we get it, it should be gone out within 24 hours or something like that?
I think the staff does the best that they can, and just as long as we try to avoid having them all go out on a Friday afternoon. Sometimes we hear from other resources about the recall earlier in the day or maybe the day before. And so I'm not quite sure of the business process of sending out alerts. I'm sure there's a lot of hoops and approvals that need to be done first, so that may be part of the delay.
Okay, well, Anne would know that some of that. Anne, do you like to elaborate on some of that?
So it feels a little bit like there's pretty significant interest in this topic. I might suggest that maybe we schedule a future committee meeting where we talk through how we receive recall notices because, people are getting information from a variety of sources. So if you wouldn't mind allowing staff some time, we'd like to pull together some information, and we're happy to provide a more formal presentation and recommendations on changes that will hopefully aid licensees in identifying them without placing any patients at risk.
Okay, thank you. Is there any other, I'm sorry, we're still in public. Any other questions?
No other comments.
Okay, can you please close that and we'll move
Yes.
on? Okay, let's move on to item number G, which is discussion and consideration of public awareness campaign, treating your pharmacy staff with courtesy. And I think this was referred to us by Kula Coyne. Is that right, Kula?
That's correct, yes.
Yes. I'm going to go ahead and read a little bit of the background and some of the stuff that the staff is um, recommending, but maybe you could, fill in afterwards and give us a little bit of the background from your meeting, from the committee that you belong to. At the June 22nd, 2022 meeting of the Medication Error Reduction and Workforce Committee, members received a presentation about the well-being index for the pharmacy personnel. The index is an online tool that healthcare professionals can use to self-assess their well-being. The American Pharmacists Association uses the index to track well-being and distress among pharmacists, student pharmacists, and pharmacy technicians nationally, as well as by state. During the discussion, Medication Error Committee members expressed concern that a general lack of respect for pharmacists among the public contributes to job distress. The committee also discussed ways to promote the well-being index among California licensees, including publishing an article in the script and posting information on the board's website. Staff welcomes communication and public education committee members to discuss and consider whether development of a public awareness campaign related to this issue is appropriate. Do committee members have any thoughts or comments on this? And Kula, if you could go ahead and jump in and
Sure. Yeah, what really struck me, so in our committee meeting, we were talking about medication error. We were talking about, the needs for the workforce. And then, when we got the survey results with pharmacists pharmacists and pharmacy techs saying that they just were not even happy in the job because they were getting really like some verbal abuse and some harassment comments. Pharmacies of color getting certain comments, and just a lack of respect and a lack of I would say appreciation for the role of the pharmacist and the level of responsibility that they have to people's health. I made a comment about, when you're on the plane and the pilot says you got to do something, everybody's like, okay, the pilot, we got to do something. But for whatever, reasons, like, folks aren't giving that same deference to the pharmacist. And if we want to, one, have less medication errors, because we also need more folks, more staff, then we need to be sure that we treat our pharmacy staff with dignity and respect. And so that's why I said, what if we had some kind of a public education campaign that would really kind of talk about what pharmacies are doing, the importance of their role. I remember driving and seeing like billboards around construction workers, and it was like, drive safely because my mom is at work. And it was like a kid, and then their mom had like, the orange hat on, and it really stuck with me because it's like, hey, these are people who are working, like, slow down in construction zones. So anyways, so that's kind of where this came about. But I think our co-chair, or Chair Nicole is here, so she can add more.
Okay.
Yes, thank you, Kula. That was wonderful, and I absolutely love this idea. I think I think there's several benefits to this. Obviously, there's always been some issues with this, but I think across many industries, we've seen an increase in this kind of abuse and harassment after COVID for a whole variety of reasons. But I think this gives us an opportunity to call it out. I would love to push it even a little bit of a step further. Let's call out not being racist and not being homophobic in this. Let's use those, because those are things that we're seeing a lot in our industry. I think we can also take this opportunity to point out that pharmacy staff are highly trained individuals. I think most people do not realize that most pharmacists are doctors, where they have this automatic respect for their doctor and do not understand that the pharmacist is also a doctor position. And I think just knowing that would convey a certain amount of respect. Lastly, I think that us doing this as the board is going to make our licensees feel more supported, that we took the effort to do this and to make this and to do this campaign. So I think there's multifaceted benefits to this. And I love the idea. Thank you so much, Kula.
Thank you. Anne, is there anything you would like to add to it or have comment on?
Yeah, I don't think so. Oh, sorry. At the staff level, we'll take these comments back and try to come up with a couple of different ideas. We are a state agency, so I wouldn't say we're flush with money. So we'll probably need to try to do some things and look to see if there are people that we can partner with to help deliver the important message. I guess my one question would be, if we are able to partner with other agencies and maybe leverage some of their resources, are we okay if other people are branding this? It's more about getting the message out than who is sending the message, or do members feel really strongly that no, this messaging really needs to be strictly from the Board of Pharmacy?
Okay, so you'll get back to us with some recommendations from the staff, right?
And I would say we have to pay my I guess personal comments would be if we could partner with any other agencies or anyone else that might help carry that message forward, absolutely. I mean, we're really trying to help, those pharmacists to have a better work environment. So whether it's, even through their employers or through other agencies we could partner with. Now, who's delivering the message, but the message reaching everyone.
Oh, true. Thank you.
And Ricardo, I would like to add that
Sure.
This is an issue that has come across a lot of industries, and so I would be curious and encourage you, Anne, to check with DCA, see what other professions are having these similar impacts, and maybe there could be something at a larger agency-wide DCA platform that we could go and work this through.
Yeah, and also how,
Thank you.
they're, delivering that message. I know the airlines are going through it, everyone's going through it, right, in one form or the other. But, I think we also need to look at what's the underlying issues that are causing patients that are visiting these pharmacies to, react in that manner, right? What is it? Just the shortage of staffing? Is it the ratio and, long wait lines? Trying to fulfill their, prescription when they're in need and they feel, their health is at jeopardy. I mean, there's, we should look at, I think, maybe the staffing issues as well are causing some of that frustration as well. And I think, there's multiple layers to this, but, but for sure, we need to get the message out there that, these roles are important and they affect us all.
Okay. We have Nicole. You have a question? You have your hand up there.
I think Kula had her hand up first.
Oh, okay. I can't see her on that screen here, but
Sure.
okay.
No
Cool.
worries.
Go right ahead.
Yeah. Oh my goodness, I think I just had a thought. Oh yeah, underlying causes. I think Jose brings up such a great point about, what's happening. And so this transparency and clarity as well. So in the communications that we put out, and I started to see a kind of a multi-pronged communications campaign that's also around being patient. Be patient with your pharmacist, right? Here's what they're dealing with, right? And so just kind of sharing some of that information as well, because when people know the why, sometimes that's also helpful. So, whatever, I'd love to see staff come back with like, here's some key messages that it hit at these points we've made, and then also here's some avenues for dissemination of these messages. That would be great.
Okay. And we have you still have your hand up there, Nicole. Did you have a question?
Yeah, just was going to add on to what Kula said. Yeah, I think in this campaign, explaining the importance of what the pharmacists do in terms of safety. As was mentioned in the introduction, a lot of patients think that we just put a label on a bottle and count pills. They do not understand the multifaceted pieces that go into making sure a medication is safe. And when we've had upset patients and we've spent the time to educate them, they turn around and are actually very grateful for what we do. So I think if we as an organization can help them understand, that would be great. Going back to Anne's original question about partnerships, I think this would be a great opportunity to partner in doing this kind of campaign. I could see it being an ongoing campaign. Can we work with LGBT groups during Pride? Can we work with the different groups that are doing racial justice work to make targeted messages that incorporate those groups as well?
Okay. Any other comments from committee members? Okay, hearing none. Any public comments? Moderator, can you open up for the public?
Thank you, Mr. Chair. I've opened up the Q&A panel. If any member of the public would like to make a comment, please type comment using the field in the lower right-hand corner of your screen and submit it to all panelists, or you may simply raise your hand. If you've called in, you can press *3 to raise your hand. We are displaying instructions and we'll give you a moment. All right, I see no requests for comment at this time. Shall I close the Q&A panel?
Yes, please.
Okay.
And do you have enough direction here to take back to the staff, or do you need any board direction from this board?
Oh, I think the conversation's been extremely helpful. I'm hopeful that we're going to hit the mark straight out the gate, but if not, we look forward to your additional comments. We will absolutely pull some ideas together, look for some partners in this endeavor, both, at the state level, but I'm also thinking there might be opportunity at the national level. It feels a lot to me like it's multifaceted. I think we could be even just like a little bit of the campaign talking about everything that a pharmacist has done to keep you safe during COVID, right? Just like, I think we can hit lots of different things. So my mind's kind of spinning with lots of different ideas. I really appreciate the comment and all of the feedback. And we'll work on trying to pull together some things, and then you'll let us know where we've hit the mark and maybe where we've missed a little bit.
Thank you so much. We will now move on to item H, Senate resolution designating September 2022 as Opiate, Heroin, Fentanyl, and Prescription Drug Abuse Awareness Month. Little background: State Senator Patricia Bates, R. Laguna Niguel, has introduced Senate Concurrent Resolution 115, which would designate September 2022 as Opiate, Heroin, Fentanyl, and Prescription Drug Abuse Awareness Month. The resolution includes important legislative findings, including in 2020, more than 14,800,000 opiate prescriptions were written in California. From 1999 to 2020, inclusive, more than 500,000 people died from overdoses related to opiates in the United States. The number of deaths from fentanyl, I can't pronounce it, overdoses, yeah, fentanyl, overdoses increased by more than 2,100% in California in 5 years. Overdoses of synthetic opiates killed nearly 4,000 residents in California in 2020, with 3,946 attributed to fentanyl. 75% of new heroin users were first addicted to a legal prescribed opiate drug. Drug overdoses kill more people in 1 year than do the number of motor vehicle fatalities in the United States. Today's meeting, staff proposes posting the legislative measure on the board's website under prescription drug abuse prevention and developing a social media campaign. As part of the campaign, the board could highlight consumer information on the website, including the importance of removing unused medication from the home, drug take-back locations, treatment resources, etc. Are there any committee member comments on this item?
This is Jose. I think getting the information out there, I mean, supporting this absolutely, but on social media and creating the awareness, again, the communication outbound, for the message to get out there and how destructive some of these opioids are to families, and highlighting that in part of the campaign. It's important. I think it affects everyone, and yes, it's good to highlight the month, but I think the campaign is going to be important as well, not just another proclamation, another piece of paper on some wall, but I think getting the message out to as many households as possible would be just my comments.
Okay, thank you. Any other committee member comments?
Yeah. So I guess my question is a couple questions. One is, who's the audience for this social media campaign? Because if we are trying to get this out to members of the public, I don't know how many members of the public are on the Board of Pharmacy's social media page or website. And so that's just one question that I'm trying to understand who our audience is.
Hi, thanks for the question. Yeah, so I do believe that the audience, the intended audience, is Californians. We may not have a lot of, individuals on our social media, but I do think that DCA and some other state agencies may. So we'll probably be leveraging other people's as well. I think that, I think that the intent is to raise the awareness, and so we're trying to leverage the resolution, and hopefully other people are also seizing on this opportunity and we can be coordinating efforts. But I do think that there's other people that we can reach out to help get this information out. And I think it does a couple of things. Hopefully it will also raise the awareness about the board, its social media presence through other people, and hopefully draw people to our website, because we do have some really good consumer resources, not only related to prescription drug abuse and prevention, but lots of other topics that may be helpful for them.
Thanks.
I think this is Nicole. I think it would also be really helpful to link the Naloxone campaign to this campaign. Since they are interrelated, we may be able to use this campaign as a way to encourage pharmacists to do the Naloxone work as well.
Point.
Yeah, I second Nicole's sentiments. This is Jason, and I really think this is something that the board should fully participate in. I think that our members really need to go and take an interest in advocating and getting the information out there, especially about naloxone and the dangers and prevalence of fentanyl. It is significant, and it has a hand in so many problems that are occurring within this state. So I think I fully support staff's recommendation.
Thank you. Any more comments? If not, we'll go ahead and move on to public comments. Moderator?
Thank you, Mr. Chair. I'm opening up the Q&A panel. If any member of the public would like to comment, please type comment using the field in the lower right-hand corner of your screen and submit it to all panelists, or you may simply raise your hand. We're displaying instructions and we'll give you a moment. All right, I see no requests for comment at this time. Shall I close the Q&A panel?
Yes, please.
Okay.
Thank you. Let's go to item number I. This is the update on communication and public education activities by staff. Anne, would you like to do an overall on the script, staff outreach, news media, educational resources?
Sure, happy to do so. So the meeting materials do highlight our efforts in various areas. So specific to the script, we do hope to have the next issue out in the next month or two. We've detailed out many of the topics that we will be including. We're going to continue to provide COVID updates, unfortunately, very much continuing to be involved in there. We've also, the Enforcement Committee earlier today received their annual presentations on the top types of violations that result in citations, the top types of corrections we find in inspections. All of those kinds of information will hopefully be able to be included in this issue as well, given the timing. It seems to match very well. With respect to staff outreach, we've done a number of presentations to the schools of pharmacy to assist their graduates in understanding the application licensure process. It provides good information to them, but it also does help the board because we really try to highlight like common deficiencies and those kinds of things. It's our goal to help individuals understand what the requirements are so that they can speed through the application process in an easy fashion and not be stressed out by those additional things. So they can just really focus on preparing and taking that test and becoming licensed. We did include a summary of the efforts undertaken by the licensing committee specific to the listening sessions that were convened with technicians and pharmacists as a precursor to that technician summit that happened earlier this year. There's a couple of other items that didn't quite make it into the report. We've done some CE presentations, and President O, myself, and Dr. Acosta had the opportunity to attend the California Pharmacists Association's annual meeting. We had a great time interacting with so many of the stakeholders that were there, both one-on-one, and then had the opportunity to provide a couple of presentations, both on compounding and the requirements for compounding, as well as pharmacy law updates and board updates. The news media information is included in the attachment, so I'm not going to go through all of that. But previously, the committee had requested that the board develop, or board staff develop, information about Senate Bill 362, which was the legislation that prohibits a community chain pharmacy. I'm oversimplifying, but it, in general, prohibits a community chain pharmacy from imposing workload quotas. And so we have released the information sheet. It talks about not only how to file a complaint and the types of information, but also mentions some of those whistleblower protections that maybe might make it a little bit easier for pharmacy personnel seeking to file a complaint to feel a little bit more comfortable doing so. So that information is in there as well. We do continue to update, many of our informational brochures, and most recently the pharmacy inspection brochure. And this is all done by, great staff, Bob Davila, many of our supervising inspectors. We drag counsel in. So I'm continuing to really, try to maintain very viable and helpful information and education for both our licensees and consumers. Thank you for your time.
Thank you, Ann. I just wanted to point out what a fabulous job you do, and also your staff, including Bob Davila. It doesn't go unnoticed. You guys do a lot of work behind the scenes, and we get a lot accomplished on this board because of the hard work you guys put in. And I wanted to just let you know we appreciate that. Any committee member comments? Okay, hearing none. Moderator, can you open it up for public comments?
Thank you, Mr. Chair. I've opened up the Q&A panel. If any member of the public would like to comment, please type comment using the field in the lower right-hand corner of your screen and submit it to all panelists, or you may simply raise your hand. We are displaying instructions and we'll give you a moment. All right, I see no requests for comment at this time. Shall I close the Q&A panel?
Yes, please.
Okay.
Okay, thank you. Let's move on to item J, future meeting dates. Meeting dates in 2023 for this committee will be posted online under Communication and Public Education Committee meetings when they become available. So we don't have those dates yet, but that's where you can find them. This concludes the agenda for this meeting. Unless there are any comments, this meeting is adjourned. And I would like to just point out that it was all done in 50 minutes and we discussed a lot of issues and we were thorough. And I want to say thank you for your participation. We are
Excellent
adjourned.
job, Mr. Chair.
Yes, thank you all. Thank you, Chair. Thank you, staff. I like
I
it.
wanna-
Efficiency.
Probably one of the fastest committees,
Love
but
it.
we got a lot done. And I appreciate all your support and
Great.
involvement. Thank you.
Thank you. Bye-bye.
Thank
Bye-bye.
you.